Look, thank you for having me here today to talk about this issue. And as we've just marked, it's a very appropriate time to be talking about workplace health and safety. With the background of Pike River, I want to talk to you today about where we came from, and I'll start at Pike River, though we could go back many years before that. What was recommended by both the Royal Commission and a subsequent task force that was set up, and what is the actual result? Where have we got to? And then Angela will be talking about more specific issues related to you yourselves. So the Pike River mine exploded at 3:44 p.m, exactly 5 years ago today. The Royal Commission was set up to investigate that, and it found a terrible story of incompetence at many levels. The operator, the mine operator, was incompetent even to the degree of the design of the mine and whether or not they could get coal out of there. They were misleading even their investors, let alone their own workers and the local community. It was driven by production and profit rather than the safety of the people working there. I'd recommend to you, if you haven't read the report of the Commission, then read the Tragedy at Pike Mine book by Rebecca McPhee, which is a very readable but very sad account and very punchy account of what happened there, with all those different layers of, in effect, was something that the Serious Fraud Office should have been investigating, as well as the health and safety authorities. And she documents this very, very well. There was no attempt to, in fact, was suppressed any attempt to allow workers to participate in their own health and safety. At times when they pointed out failings within the mine, they were either ignored or told effectively to shut up. And there were major failings from the regulator. At that time, the Department of Labour, the inspectors, were told, we don't tell companies what to do, we assume that they're going to do a good job for everybody, they've got a great incentive to do that, or they might lose their reputation. Therefore, we just tell them, we encourage them to do the right thing. They were encouraged in that by an attitude from the government, which basically gave them no support for enforcement activities, and they were held back by increasingly poorly funded enforcement effort. Whoops. If we look at the record, just one indication of that record of lack of funding for enforcement and mine inspections. This is the number of inspections in the sector during the 1990s, between 1991 and 1997. And here is the number of serious harm incidents going in the opposite direction. Now, I'm not saying that there's a perfect correlation here between the two, but clearly there is a relationship between the good inspection, good regulator activity, and what actually happens in these environments. These come from the Royal Commission report. The Commission report and Rebecca McPhee's book read like a Shakespearean tragedy. You can see all these things building up to happen, and you get this feeling of inevitability that ended, or in another way just began with that explosion just 5 years ago. So the Royal Commission recommended a very large number of major changes to health and safety law, the regulator, the duties of employers, and to funding and so on, in all areas of workplace health and safety. At the same time, the government set up an independent task force on workplace health and safety, of which I was a member, to provide recommendations for the workplaces across the country rather than just the highest risk ones in mining. Now, to understand kind of the context of health and safety regulation and systems, it's important to understand what's called the Robin system. This dates back to an inquiry carried out in 1972 in the United Kingdom by Lord Robins, who was, as you might guess, a peer there, but actually from a trade union background. And what they were confronted with was a system that had grown like Topsy, a whole system of regulatory of laws and regulations that were very specific to a whole lot of different types of workplaces and were becoming unmanageable. And what they proposed, and what has kind of been the basis and the gold standard, if you like, for health and safety regulation since then, is one that is performance-based. It's described in terms of the duties of people in the system, and it describes responsibility to the people who have most control over risk in the workplace, and that is the employer, essentially. We'll come to that in a minute. Come to it again in a minute. And it also set up this, what we like to talk about as a three-legged stool of balance in the work in health and safety. And in many ways, it's very similar to what I think you probably think about a lot in terms of setting up fault-tolerant systems. That is, you know that people make mistakes. You know that things do go wrong, systems go wrong, management goes wrong, your procedures sometimes go wrong. So you have systems that ring bells, ring alarms when things go wrong. And that's the idea of this, that you have a strong regulator who's capable, knowledgeable, has the powers to enforce when needed, has the backing of our political leaders, and also has a capacity to persuade as well as to enforce. You have employers who are knowledgeable and capable of managing risky systems. They know about risk management, and they involve their workers in these decisions. And you have empowered workers, and that means that workers have a direct decision-making power and influence in the safety in their own workplaces. This might sound familiar to you in terms of condition involvement in your own workplaces. It's simply a matter of the people who are working there know most about what the risks are and the best ways to address them. The statutes under the system are based on these general principles, but underlying them are a whole set of regulations and what are called approved codes of practice that have some legal weight, guidance and various other supporting materials to tell people how to do things when they don't know how. Whoops, I keep on clicking on one. The act that was brought in to, in essence, bring in these Robin's principles was brought in 1992. It was called the Health and Safety and Employment Act, and is still actually in force until April 2016. The Independent Task Force on Health and Safety, which I was a member of, concluded that the model of occupational health and safety regulation implemented through the Health and Safety and Employment Act in the early 1990s may be seen as an object lesson in how not to implement legislation. It came at the same time as the Employment Contracts Act, which basically meant that unions disappeared in a large part of the workforce, and they were acknowledged to be a strong force in improving health and safety. It came at a time of reducing government funding, so the regulator was not properly funded. They decided as part of that they would not put in these underlying regulations and codes of practice because that just was too hard work. So ended up with a very under-resourced, half-done system. So the task force highlighted the failure to implement the Robin system properly, the terrible record that has resulted in New Zealand in workplace injuries and deaths. We have about 80 workplace-related fatalities by injury per year, which is, we found our data was terrible. So you have to take these figures with a grain of salt, but the best we could make out is about twice the level of Australia, 4 to 6 times the level of the UK. On top of that, these injuries are what we most often talk about, but on top of that, there's a very high level of occupational disease and injury. The report estimated 500 to 800 premature deaths from occupational disease per year on top of that. So this is a huge toll on our workforce and doesn't even include serious injury on top of that. We found confusing regulation, multiple agencies responsible for these things, a weak regulator, as I've described, poor worker engagement that hasn't been properly, what was there hasn't been properly enforced. There were health and safety representatives put in 2004, but they weren't properly enforced by the regulator. Insufficient training, not enough knowledgeable people in health and safety, no incentives for employers to do the right thing, and particular challenges for small companies, and we'll come back to that. A number of other things, poor data, risk-tolerant culture, this huge hidden occupational health problem, and so on. So the Taskforce recommended, and many of these things reinforced what the Royal Commission had recommended, that we should have a new regulatory agency, which is now called WorkSafe, which was tripartite in design, so it included representatives of government, employers and unions, that it would have full powers over the whole area, developing policy and codes of practice, guidance and education. It would be the lead regulator in the area, and that we would have a new law based on a recently developed law in Australia, the Australian Model Law, which had been developed after long consultation with employers and unions. The essence of this model law are quite revolutionary in a way. Rather than workers being solely employees, they include the contractors who are now becoming a bigger and bigger part of workplaces. So they're workers as well as employees under this law. The duties that exist for employers would extend to what are called rather ungainly term persons in control of a business or undertaking. The idea of this is that it applies not just to your immediate employees, but if you employ contractors and subcontractors and so on, and your suppliers up the supply chain, all hold responsibility for each other, have to work together to ensure there are the best possible health and safety protections in the workplace. And recommended a corporate manslaughter offence. The key duty is that these PCBUs, persons controlling business or undertaking, most of them are employers, must do everything reasonably practicable to ensure health and safety, taking into account a number of factors, but all relevant factors. And what is new in this is that it includes, after assessing the extent of the risk and the available ways of eliminating or minimising the risk, the cost associated with available ways of eliminating or minimising the risk, including whether the cost is grossly disproportionate to the risk. In other words, cost was to be a very secondary factor after all the risks and the ways of addressing it. First of all, address it. Then address cost only if it's grossly disproportionate to the risk. Stronger penalties and some possibility of cost recovery from offenders. Stronger worker participation, a duty on the PCPU to engage with workers, elected health and safety representatives whenever workers wanted them, or committees, and expanded in powers for health and safety representatives so that they could, if there was an immediate risk, they could call on their fellow workers to stop work, and they could put in what's called a provisional improvement notice requiring the employer to address significant health and safety issues. They'd be given the training and the time to do these things and the resources to carry out their functions. And they'd be protected against any repercussions that might happen from their employers. And there was stronger protections for people who raise these issues, which is always a real problem, as we saw with Pike River. A number of other recommendations, I won't go through them in detail, but you can see them on the slide, that would boost the strength of the system. So what actually happened in terms of the law that we have and the regulations and codes of practice? Many of these recommendations have been carried out, so on the whole, we do have a significant step forward. But the government did not implement some key recommendations, which makes us very disturbed. Firstly, WorkSafe does not have that tripartite governance of a right to representation from unions as well as employers and the government and government representatives. It's not recognised as the lead regulator. It shares a policy role with MB, which means there's very confused lines of responsibility. The political backing for it is increasingly in doubt, with the Minister making statements that WorkSafe should engage, not enrage. In other words, it should really just talk to people and persuade them rather than take risks that you upset them by enforcing the rules, which is very much has a very 1990s feeling about it. And for that reason, WorkSafe is backing off these codes of practice and only putting in place guidance, which is a much weaker form of underpinning to the law. And there's little sign of the public education campaigns that are so successful in areas like road safety. Most importantly, there's been a failure to fully implement the worker participation area, which, as you remember, is one of those essential legs of the stool, and the places that are high risk of not having that fault-tolerant system, if you like, that is so important in this area, and we saw that at Pike. There's sound international evidence, and I'm just quoting here from a paper that was just published recently, but it reflects previous research, that firstly, worker participation and how workplace health and safety is managed is good for health and safety. Secondly, participation through elected representatives with sufficient legal rights is even better. And thirdly, union support for safety representatives and worker participation achieves even better results. The original bill required elections for health and safety representatives if workers requested it. But after considerable lobbying, the government has removed the right to health and safety representatives in workplaces with less than 20 workers. So they have allowed some exceptions for so-called high-risk industries, but this is a very poorly defined idea and will be almost impossible to implement in any coherent, consistent way. And you'll have probably heard the worm farms controversies, that people working on worm farms were regarded as high risk, but those who are on dairy farms and so on were not. It deliberately excluded farming, which is one of the highest risk industries. In larger workplaces, there are also ways for employers, PCBUs, to minimise the use of the presence of health and safety representatives. There is still a duty for PCBUs to engage with workers, but many won't know how, and we know that because many, particularly small businesses, are simply not competent in the area of, well, frequently not competent in the area of management, but certainly not in the area of workplace health and safety. And again, this paper that I quote goes into that in some detail. It conflicts with a very common command and control form of management that I guess you're familiar with too. So there is a severely weakened leg of the stool there, if you like, which gives us considerable concern, and it particularly applies to the least capable employers. There's a huge MB and WorkSafe work program to get these regulations and codes of practice and so on in place. And WorkSafe is under considerable stress, not only managing what needs to be several hundred documents if they're going to get this right for all the different industries and so on. But also they need to hire new staff, and they need to train them so that they're competent, and they need to put sound policies of their own in place. So there's an awful lot for unions to do, and I hope that you can get engaged in this yourselves in making sure that these things do the right thing this time round. There is the basis there for a better system, but I think it probably needs a change of government to strengthen that third leg of the stool. So are we there yet? Well, there is a significant step forward, but as the paper I quoted, which was written by an expert, Gunningham, Neil Gunningham, who was actually brought over to inquire and to recommend to the government what it should do in the Department of Labour following the tragedy at Pike River. He said, Pike River Royal Commission was the 10th inquiry into mining disasters in New Zealand's history. It is an open question whether it will be the last. Thank you.